Hello, everyone. My name is Carissa Brewster. I am the writer for Whitman Partners, and we have today our 40 Fast and Future Leaders of Surgical Services for 2023. And today we have one of our winners, Ashley Vanderzee. Welcome, Ashley.
Thank you.
You're welcome. And can you tell us your current position and facility?
Sure. I work in professional development as a perioperative nurse educator, and I support Sacred Heart Medical Center and some outlying Providence facilities for content.
Excellent.
I think everyone can say COVID changed the workforce. It changed how we approach our work, healthcare, and how we approach nursing care and technology care. Our caregivers were redeployed into different care areas. They were floated around, learned new specialties. And I think they came back with a newfound priority of work and life balance, quality in their work. And I think that really changed how I approached education. It needed to be from a place of quality and good intent and to be utilized directly in their care regularly. This couldn't be drive-by educated education. It needed to be something they could use in their day-to-day. It needed to be high quality for them. I think we have to be flexible in our approach and how we have conversations with our caregivers, how we approach new initiatives. I think we need to understand where our caregivers are coming from. We need to meet them where they are and understand they are the ones doing the work and we are there to support them. So we need to have that flexibility. I also think we need to have some vulnerability when we approach our caregivers. We don't have the answers to everything. We are not experts in everything that we do. And it's up to us to seek that feedback, to find those resources for them, help them feel heard and validated, and include them in that response, in that solution finding. When they drive that work and they're engaged in those changes, that's when we see the shift in the care that we provide. That's when we see the shift in our patient outcomes, our quality metrics, and we see those retention numbers tick back up because they're so engaged and they feel supported and encouraged. What we do in the OR, we have to have a solid foundation of knowledge in what we're doing in the care we're providing. If we don't know what we don't know what harm we could potentially cause our patients. We know when we invest in education upfront, in competency and quality of that education, what we see are better patient outcomes, better critical thinking, better solution finding, the ability to function in high stress scenarios because they have the knowledge. There's been a huge decrease rather in perioperative educators. So we've had to get creative in how we deliver our education. We've done virtual hybrid models. We've used preceptor models. And what we have found is that with the appropriate support from the educators and leaders that we do have, we can use those hybrid models, but we need to align ourselves with our national organizations, with our best practices, and making sure that we're staying aligned in the movement in perioperative care in general. So really, the biggest thing is hip to hip, listening to our caregivers, supporting our preceptors, and providing them with the newest and the greatest evidence-based practice. I like to think that I approach all of my caregivers from a place of vulnerability and respect. When you meet someone where they are and you hear what they have to say, you have the ability to connect. You have the ability to validate their experiences and provide them with what they need to give our patients the best care possible. By following through on things that we commit to, we're showing I am invested in you and the care that you're providing, and I think it's valuable. So talking the talk and walking the walk, I think that matters a great deal to our caregivers. Sure. I think right now we're finding as we're bringing surgery back into full swing post-COVID, we've had a great deal of staffing movement and shifts and a reduction in our workforce. So that means we're bringing in agency caregivers, training more caregivers, taking things down to the collegiate level to meet with our nursing students and surgical techs while they're still in school. And when you have a workforce that has been consistent through a really large pandemic and staffing shifts and changes and an increased number of cases, you see an increase in call burden. You see an increase in precepting. And I've heard from many caregivers the ask never ends. And I have to agree with that. We're asked to do a little bit more with a little bit less, and asked to do so with no harm. So I think what you can find are some caregivers are getting burned out or they're tired, and there's opportunity in some of that tiredness to make mistakes. So making mistakes could lead to harm, or having full engagement in your work means we've provided the best care to our patients, but there's opportunity for that. So I've heard rumblings and conversations, pulling AI into healthcare, utilizing it for our throughput, utilization of block time, making sure we're doing the most we can with what we have. I think it would be a great opportunity for us to find latencies or finding duplicate work and reducing some of that, utilizing our caregivers to the top of their scope of practice and utilizing that time well. I think we have to be cautious in our approach to AI because we don't know everything about it yet. And what we don't want to do is undermine any of the clinical expertise that our caregivers have. But you never know, really great things could come. Feel very, very deeply about communication and how we communicate with one another. I'm actually a high reliability coach where I work currently. So I've taught a lot of classes on high reliability, implementation of communication skills, escalating concerns, and how to have those hard topics. I think the biggest thing when I approach one of my new peri-op cohorts is to say, our communication is 93% nonverbal. What I say is only 7% of what I have communicated to somebody. So our body language, the tone we utilize, being clear in our communication, taking that opportunity to ask those questions, seek out that clarity, and raise those concerns. That very first time you raise a concern, your face might be really red and your heart rate might be really high, but that's when it's most important to raise that concern, ask those questions, because we're here to provide really good, safe care every time. That's a really great question because I think there are multiple ways in which we could approach this. I think one of the biggest things we could look at are our reductions in surgical site infections. I think the CDC said this year it costs $3.3 billion every year, surgical site infections do. This is the loss of profit, extended hospital stays, harm to patients. I think we can lose some trust in the community when we have high infection rates, and that also reduces our profit. So being that I'm an educator, my thought is let's look at our quality. Let's look at how we are providing the care and let's invest in that. Let's take a look at a gap analysis. How are we actually providing care? What can we do to address those gaps? Implementation of policies, practices, audit those practices for compliance, and then we can take a look at our impact in surgical site infections. I think it costs individual hospitals millions of dollars if we don't take a look at the care we provide and the potential harm for our patients. So something we want to focus on anyways, reduction in surgical site infections, I think it absolutely increase our profit. It also increases the trust that we have in our community, which again is going to bring more patients into our facilities. So I think all of them pose a challenge individually. In my experience in education, I am continuously advocating for peri-op education, expertise, and what we do in our care area. So for me, probably the hardest is administration because I have to explain the nuance of the perioperative care world, which can be sort of hard to do. I view that as an opportunity to show people our world. We're not just those who are wearing all the same outfit, covering our hairs, wearing surgical masks, and working, beyond a red line. There's a lot more that goes into it, and I view my position as an opportunity to explain to those other people, this is the care we get to provide, this is what we get to do in our world. And that takes a little bit of tact and a whole lot of practice. But I think it's an opportunity to advocate for our specialty and to grow our specialty.
Perfect. Thank you so much for joining us.